And in the Ashanti region, the Health Directorate has identified 10 communities as hotspots for potential spread of coronavirus. The region's case count has increased from 17 as of Monday to 25 as the national confirmed cases rose to 313 with 6 deaths. Regional Director of Health, Dr. Emmanuel Tinkrang, says the upsurge is due to what he says is active surveillance adopted by the Directorate. He has been speaking exclusively with Love FM's Prince Apia.
The situation in the Ashanti region, as I said, we follow closely Greater Accra. So far, we've identified 25 cases. The 25 cases, some of them were contacts that we were tracing, and then some of them were patients that we identified through our routine surveillance. And all those that, the 25, we also have another strategy to make sure that we get their contacts. The reason why we are getting more cases is that we are doing active surveillance. We are actually going looking for cases. Yes, where people go to hospital and they are diagnosed, we call it passive surveillance. So this time we've added 2 strategies: enhancing surveillance, active surveillance, moving to high-risk areas, and then picking cases. And
so with these 8 new people, were they all, are they imported cases? Are they people who have travel history, or they are, residents who have had contact with an infected person?
3 of them have contact travel history, and then about another 3 of them has contacts with people with infection, but 2 of them no contacts, no travel history. Yes, and we are getting those community spreads. We are getting them.
Must we be worried, the community spread?
No, not at all. Not at all. As at now, the rate is not very high, but as I keep on saying, we should observe the rules and the regulations.
You mentioned that there's been some hotspots depending on the individuals or the people that get infected. How many hotspots have you identified in the Ashanti region so far?
You see, so far we are having close to about 10 hotspots. The reason is that for every case we get, every positive case we get, that area becomes a hotspot. So we started with 5. Right now we are moving close to 10. And the more we get cases, the more hotspots we'll be getting. So far we have about 10 hotspots.
What does that translate into? What kind of picture does it paint? Must we be worried?
No, we shouldn't be worried at all. The reason is that if we adhere by the protocols and then the guidelines, then there's no need to fear at all. Because though it may be a hotspot, but you are not going out to get yourself infected. You only put yourself in danger if you try to do the wrong thing.
In this communities that you've identified as hotspots, what is happening to the residents there?
First we trace the contacts. So we talk to the person who is infected. He will tell us all the contacts that he has come into contact with, all the people, and then we also identify them. Then 1 kilometer radius of that house where we had the infection becomes the hotspot. So that why we move house to house.
And so far you are getting people voluntarily coming in this?
It has been very perfect.